Okay, for my final presentation for Midwifery 1030 Human Lactation, I will be talking about the factors that contribute to nursing struggles. There are some interactive factors that we'll talk about that contribute to some nursing problems. These factors include post-delivery practices that may interfere with newborn feed behaviors, such as labor medications, routine suctioning, early cord clamping, unnecessary formula supplements, and parent-baby separation. Positioning issues when nursing and poor fit based on nipple size and shape may also be contributing factors. There are also some possible solutions to some of these factors. A lot of the times it can be difficult to combat post-delivery practices that interfere with newborn feeding behaviors. However, several studies have found that nursing outcomes during the hospital stay appear to be better when babies do the breast crawl at the first feed. A study by Girish et al. From 2013 found that nipple pain occurred in 44% of mothers whose babies did not breast crawl, compared to 24% of those who did. Also, delayed milk increase occurred in 60% of the mothers whose baby did not do the breast crawl, compared to 24% of the mothers whose babies did. In addition, using starter positions to allow newborns to be in an active role in getting to the nipple and latching may improve nursing. Relaxing into a semi-reclined position while supported by pillows so that the parent can fully relax and allow the hormones, when you relax, to start pumping, can allow the baby to rest tummy down with their hands free on the parent's body and have easy access to the nipple. Then the parent's arms can act as guardrails for the baby for head support if needed. This position uses gravity, allowing the baby to have responsibility and manage milk flow easier. When dealing with poor fit, with nipples, using different feeding positions for breast variations may be helpful. When the parent has large nipples and the baby has a small mouth, parents may have to wait a few weeks for baby to grow to become big enough to nurse properly. Next, we have the baby factors that could contribute to some nursing issues. Some of these factors may include pain from birth that the baby is experiencing, maybe feeding aversion from rough suctioning or rough handling in birth, oral anatomical variations, health problems, nipple confusion, inability to cope with milk flow variations, and if the baby is dealing with pain from a circumcision or other procedure. Here are some possible solutions for baby factors. Trying to avoid the early use of artificial nipples to prevent nipple confusion, if possible, would be ideal. However, it's not always possible. If you do come across some of these factors that may be contributing to some nursing programs, use strategies immediately that will help feed the baby while safeguarding the milk production. Use strategies to either continue trying to nurse or supplemental feeding methods like expressing milk, using donor milk, or formula. If baby is in pain from a traumatic birth or is recovering from a medical procedure like a circumcision, using different positions or expressing milk for the first few weeks for baby until the injuries have healed may be a good option. Next, we have the parent factors that may be contributing. Parent factors that may also contribute to nursing problems include taut mammary tissue from edema caused by excess IV fluids, sometimes in labor, especially at hospitals. Um, Parents receive too much IV fluids that can cause edema and tightness in the mammary tissue that has an effect after birth. Um, Other factors that may contribute is just a fullness from increased milk production after birth. There is a release of hormones that happen after birth that introduce milk production, and sometimes that can be too great and cause a little bit of an issue there. Also, maybe causing engorgement. Um, Issues may also sprout from a delay in milk production. Maybe or from a fast flow from overabundant milk production, which may overwhelm the baby, or if birth trauma happens, that can take an emotional toll on the parent. Here are some possible solutions for the parent factors. If dealing with some taut mammary tissue after birth due to over uh, overuse of IV fluids, parents can start with reverse pressure softening and mammary shaping. If that doesn't work, positive pressure by hand expressing enough milk um, to soften the areola may also be a possible solution. If dealing with an oversupply, try nursing baby in an uphill position rather than a downhill position where you're using gravity and the milk is flowing into their mouth. Make them work for the milk and give them a little bit more control over the milk flow. Some babies can also handle milk flow better when nipple shields are being used, so that might also be another possible solution. If dealing with a low milk supply, it may be helpful to eat a diet high in protein, vitamin B12, calcium, iron, zinc, iodine, omega 3 fatty acids, healthy fats, and fiber, while also utilizing other strategies to help increase milk flow. You should always reach out to your personal healthcare provider for more specific instructions on how to combat low milk supply or oversupply. And here are my resources, and thank you so much for listening.